Hello, my name is Robert Bono. I'm a cardiologist at Northwestern University, past president of the American Heart Association. And I'm going to be speaking briefly about a new clinical trial presented here at the American College of Cardiology in 2014 in Washington, D.C., called the CHOICE trial. It's called CHOICE because it's a comparison, a head-on-head comparison of two of the new aortic valves that can be implanted as artificial valves through catheters in patients with very tight aortic valves, something we call aortic stenosis. These two valves are now approved by the FDA. They are marketed by different companies, have gone through their own clinical trial mechanisms to get approval, but there's never been a head-on-head comparison, head-to-head comparison, and that's what we're seeing in this particular trial. You may have heard about the recent trial that came out from the device called CoreValve, which is a self-expanding stent. You put it in the aortic position and it expands to fit the size of the valve after you deploy it with a catheter. And the other valve is one which is expanded with a balloon. It has a stent that gets crimped. You put it in the position and then you expand it with a catheter that will pressurize the stent to expand it fully. So this is a comparison of two different ways of delivering these new valves. One which will be pressure expanded to fit well, and the other which slowly is self-expanding. And what we find with this trial is somewhat important. I should point out first of all, however, it's a small study. Small by our comparison. It involves 240 patients. We're used to trials which include thousands of patients. So the data are somewhat preliminary given the fact that it's a small number of patients. But what we found is important, and that is the CoreValve valve, which is the one which is self-expanding, is associated with a need for pacemakers because it can cause rhythm problems that make the heart go too slow, cause something called heart block, where a pacemaker is needed. And although that's a risk with the valve which is pressure expanded, the risk is much lower with the pressure expanded device. And so with the self-expanding valve, we find that in this particular study, 38% of patients required a new pacemaker to be implanted. That was not there before. So that's something to keep in mind if you are going to be needing an aortic valve replacement and your physician is recommending that you have this done through one of the transcatheter mechanisms, not open heart surgery. Ask the question about whether this valve is the one which is likely to cause a higher need for pacemakers or not. In some cases that's not bad and pacemakers can be good, but if that's a complication of the procedure, that's something at least to be concerned about. Other than that, these valves perform very, very well. They really transform the outlook with patients. It takes them from being very sick to feeling much, much better, having fewer symptoms, living longer without the need for open heart surgery. And so it's a very exciting and transformative new technology. This is the first trial to compare these two devices head to head. Overall, they perform very, very well, but beware at least of the fact that one of these valves is likely to have a higher risk of needing a pacemaker.